So Julie's and Susan's story are the stories of tens of thousands of men and women in this country who have to make tough choices that in many instances shatter their entire lives. But they are the testimonials of the ones who are still with us. There are the unspoken testimonials of those tens of thousands of men and women who have lost their lives because they have no access to health care in the wealthiest nation on the face of the earth. And those voices have to be acknowledged because this is in fact a movement to save lives. Ours is a movement to save lives. And for me, this became crystallized, as our friend Pat said, when I had the opportunity working with the mayor of San Juan, Puerto Rico, that many of you saw in CNN and MSNBC taking on this fellow who happens to be the inhabitant of the White House, as I refer to him, because of his criminal neglect with more than 3.5 million American citizens in this island in the Caribbean, who happens to be Puerto Rico. I had the opportunity to welcome, as a result of an invitation from the mayor, a group of 350 union members from 20 states of the union, which included a group of 50 nurses. I don't know if there are any nurses in the house tonight. Are there any nurses here? Or any people who are married? This is a testimony about nurses and caregivers. But I want to share this story with you because it has a very powerful meaning, and in fact, it transformed my life. So one evening, we are actually sitting around the group of folks who are helping to coordinate the logistics of this large delegation of men and women who came to help us. And we are sitting around in the Coliseum there in San Juan, and we get a phone call past midnight from a nurse that says, "We want to have a conversation with you, and this is a very serious conversation." And it was already past midnight. So we said, And so, yes, of course, please come over. Everybody's exhausted, tired, but we welcome the group of nurses. And one of the nurses says, "With all due respect, sir, we need you to know that we came here to fulfill a very important mission, which is to save lives, and we feel that we are not accomplishing our mission." And so we looked around at the other folks, and we said to the nurses, "Why is that? I mean, what is going on?" And one of the other nurses said, "Because we believe that everything we are doing is helping people, but it's not saving lives." And so at that point we said, "Well, what is it that you feel you need to be doing?" And the nurse said, "We need to find our way to all of those small towns in the interior of the island where we know people are actually dying. So we said, this is the moment to call the mayor. We called the mayor, and the mayor dispatched the medical director, who showed up in a matter of seconds, it seems. And we had a back and forth, and finally, one of the nurses said, "You do not seem to get it. We are saying that we came here to save lives." And I said, "But you don't seem to understand that we vouch to the people who sent you here that we would not expose you to unsafe conditions. We don't even know if the roads are passable to those small towns, and we don't even know if there's any looting taking place because people are desperate." And this was a few days after the hurricane struck. And so, we don't know what to say. And one other nurse got up and said, "Excuse me, sir, but we didn't come here to ask for your permission." That's when I learned that this is, in fact, sisters and brothers, if I may call you that, a fight to save lives. This is a movement to save lives. And this is not a movement to figure out how is it that we are going to pay so that every man and woman in this country can have health care. This is not a movement to figure out what is the policy that is necessary so that we can, in fact, persuade people to pass the necessary legislation. This is a movement that's about saving lives, so we do not have to ask permission from anybody, because this is a matter of life and death. And this is, in fact, so clear, because if Canada can pay for it, if the United Kingdom can pay for it, if Argentina can pay for it, if Mexico can pay for it, why can the wealthiest nation of the face of the earth not pay for health care for all its citizens? But you and I know that will take building a powerful, vibrant, multiracial movement, and why not saying militant movement, because in fact, this has to do with putting an end to my sons and daughters dying, to my neighbors dying, to my families dying, to people dying. This is a movement to save lives. So this will take a lot of action that dramatizes the story that we heard from Julie and we heard from Susan. And we need many more stories from Julie's and Susan across the nation, because if there is something that brings the point home, it's the story about the choice between life and death. And tell me if there is nothing more clear than the story about life and death. You tell me. So I don't want to hear any more debates about what is the right policy and what is the correct financing formula. Countries that are less wealthy than ours have figured out ways to pay for it because they understand that this is in fact a matter of life and death. And this will require a militant movement, because I submit to you, when I heard Julie and Susan's story, I didn't feel sorry. I felt rightful indignation, and I felt rage, and I felt rage, and I felt rage. You know why? You know why? Because why is a human being subjected to having to make a choice between living or dying in a place that has such incredible wealth, where there is an ecstasy of corruption taking place in the highest spheres of government, led by the very fellow who happens to be the inhabitant of the White House? That is why he went to my homeland, and the only thing that he could think of doing was throwing paper towels to the people who were the victims. Can you imagine? What compassion does this fellow have? Absolutely none. Could this fellow lead us in a way that would deliver health care for everyone in the wealthiest nation on the face of the earth? Absolutely not. This will be won in the streets. This will be won in the voting booth beginning this November, when this election. But if I learned an important lesson back in the 1960s, when I came here at the peak of the fight against the war in Indochina, in this place called Vietnam, transformational change only happens when tens of thousands of men and women are engaged, when they demonstrate their rage and their indignation, and they say, I have had enough, I have had enough. So I was very happy, because in this planet where I happen to live, called New York City, a young woman not even 30 years old, in the borough of Queens, defeated a 10-year incumbent who was poised to be the next Speaker of the House. And she happens to be a comrade of mine in this organization called Democratic Socialists of America. And some people call her a rock star, others call her a celebrity. She just wants to be known as the voice for working families and immigrants and the most vulnerable. And she will join your congresswoman that spoke here in building a powerful bloc of voices in Congress. But she will need, and your congressman will need this show of strength, this show of indignation, this hurricane that actually wipes all this conformity, shall we call it, of people who think that this is the way things have to be. And you and I know that this is not the way things have to be. And we learn it from this wonderful leader whose name to you is Cesar Chavez. To me was Cesar Chavez, who taught us to do something whenever we would be afraid. And I'm going to ask you to do it with me now. I'm going to ask you